Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm very excited today to be interviewing Dr. Ronni Brown. Thanks for being here, Ronni.
Thank you, Vanessa.
Now, Dr. Brown, I know you've been lecturing on the circuit for several years, and she has created a lot of buzz around her topics, which I believe are compelling, unique, and timely. And that's why I'm so excited for you to be here today, Ronni, to share more about these. Now, the topics, I'll let her tell you more detail, but really we're talking about substance abuse and evidence-based dentistry. So, Ronni, could you lead us in by helping, by breaking down what are the different courses that you offer, what's happening for the dental professional that would be a challenge or a problem, and how does your course resolve that for them?
Thank you, Vanessa. Well, as we know, reading the paper, addiction has become a national epidemic in this country. And most dental professionals never receive any degree of training regarding what to do when that addicted patient walks into the door. Do you treat a patient who smells of alcohol? Do you have a conversation with your patient? And so in my courses, which are Meth Mouth, A State of Decay, and Tweaked, Cracked, and Loaded, a profile of the addicted dental patient, I really help the dental team understand, first and foremost, the magnitude of its problem and the reality that they have patients who are in their practices that are addicted, and they also will continue to have patients who are in their practices that are addicted. And so I really want the dental team, when they walk out the door of any presentation I have, that they really understand how to recognize, how to communicate, and treat patients who have substance use disorders. My passion has been substance abuse, and that the majority of my patients have substance abuse disorders. I did research on the oral effects of methamphetamine, and I bring that research into the presentations that I have on Meth Mouth. But then I take a broader lens in that course, Tweaked, Cracked, and Loaded, and we talk about additional drugs that patients are most likely to abuse, such as depressants and opioids. And we talk about the challenges that are inherent in treating the addicted patients. I also have a course, as you mentioned, very different, which is known as Evidence-Based Dentistry, A Paradigm Shift. And that really comes, quite honestly, from my own problem that I think many dental professionals share, is that we are overwhelmed with abundance of dental information. And oftentimes, we don't know where to go for the best source of information to help guide the treatment that we're recommending to a patient, the treatment that we are performing with a patient, and even the information that we are communicating to a patient. And in this interactive course, it's actually a lot of fun. We start to challenge some of our old theories and dogmas and things we learned in dental school, but we also, more importantly, learn where to go for highly reliable and credible information.
Both are they're different.
Yes.
But both are so important for dental professionals. Now, is there anything important that meeting planners should know about the way you present these, as far as like, a workshopping or interaction, or like, tell us a little bit more about the format?
So my style of presentation will always be interactive, because I want participants to feel that they can communicate, that it's a very safe space for them to kind of share any part that they're confused or uncomfortable about. We have a lot of fun, a lot of interaction, but I really believe in self-discovery, because when people are able to discover their own barriers, whether it's in accessing information or communicating to a patient about substance abuse, when they have that self-discovery, that aha moment, that is when they're able to walk back into the door of their practices and make a real difference in how they're treating patients and a real difference in patient outcomes.
Exactly. That's adult education at its best. That's amazing. Now, do you find that pairing all of them together, is there a way to, like, if a planner were to bring you in for a full day, how would that best lay out?
I think really, because the topics that I have are very different from one another, I think the best way would be having a half-day session dealing with the concept of addiction, whether that is Meth Mouth as its own course, or it's the Tweaked, Cracked, and Loaded course, and then having the other part of the day focused on evidence-based dentistry. And then the attendees can really get, I think, the best of both worlds. They can learn how to walk into the door and manage the patient who walks into their practice who's addicted, but they also will have tools to be able to access the best available scientific information.
Awesome. Thank you for that. Now, is there a certain ideal attendee? Who are these best for?
I think my courses are really suited for the entire dental team, from the front office to the dentist to the hygienist to the assistant, because I think all participants can walk away with things that are going to make a real difference for their unique roles as part of their dental team.
Excellent. Well, we're nearing the end of our time together, Ronni. Is there anything important that we haven't talked about that would help the planner know how best to utilize your courses, and anything important there?
Well, I think, as I mentioned, I think these courses are well suited for every member of the dental team. I have been speaking on the circuit for close to 10 years, and I have more than 20 years of experience. And I think that attendees will learn that they can bring any questions that they have to my presentation, and my answers will draw upon my more than 20 years of experience in evidence-based dentistry, as well as in treating the patient who's addicted.
Thank you for sharing that, Ronni, and thanks for sharing all this and being here with us today. I also want to let the event planner know if they would like to find out more about your programs or about Dr. Ronni Brown herself, because I think you are just an amazing, fascinating person with a very interesting background. I'm going to dangle that carrot of intrigue, but to visit not only dentalspeakersbureau.com, but to visit her website, which is Dr. Ronni, R-O-N-N-I, Brown.com. That's D-R-R-O-N-N-I, Brown.com, where you can learn a little bit more about her working environment and her background, and where she's been published. And there's so much more than we can cover in a few minutes here. So thanks again, Ronni, for sharing with us today. Be sure to visit dentalspeakersbureau.com to find out more about Ronni's programs, and reach out to us. We'd be happy to connect you. And until next time, be well, and we'll see you then.
Thank you, Vanessa.